There are about 5 million women in the United States today who need birth control help and are not getting it. Women of childbearing age. No one is average, but typically such a woman would be in her middle or late 20s. She is a white, native-born citizen of the United States.
Over here.
She is married and lives with her husband.
You want some milk?
No.
Already they have 3 children.
Okay. What do you say?
Thank you.
They live in a city, either in or adjacent to an officially designated poverty area. They are poor. Their income is less than $90 a week.
247, 118 Darlington Road.
The husband in such a family has probably had a high school education. One of the reasons he went no further may be that they married young, partly because she was pregnant. The woman has probably had about 11 years of schooling. She is less likely to work than a woman in a higher income family. Often she has no one with whom she can leave the children. With about 80 cents per person to spend on food each day, she shops carefully. When she does buy meat, it is one of the cheaper kinds. She reads newspapers and magazines, once in a while a book. She knows about contraception, but only in a general and somewhat vague way. When she needs medical attention, she usually gets it at a clinic, perhaps in the public hospital.
Here's one for me.
She cannot afford to go to a physician in private practice.
Your first name? Sally.
The maternity ward in such a hospital may be so full that patients have to leave 48 hours after delivery.
And the baby's first name? Mary. Baby's religion?
But in all likelihood, there is as yet no birth control clinic.
No.
Hi, Robbie.
Yeah, kids.
Huh? Where'd you hide the sugar?
It's up there.
You weren't home for supper,
Right
Robert?
shelf.
Where were you?
Well, I had something to do in the car.
Come on, Doug.
Were you working today?
Yeah.
The customers' problems right there.
You guys had lemon meringue pie?
Uh-huh.
Oh, boy, did I get taken for a ride tonight. What's not so right?
Underneath, Cheryl, on the end.
That's right.
Right on the end, other end. And covered. And covered.
And you don't even bid anything at all.
I know. I never think.
Not yet.
I had 2 marriages. I laid
You
down.
coming up to stay up now?
Honey, where's Patrick?
You coming in to stay in now, Roy?
That's all I need to know.
Couples like these use contraception erratically, if at all. Condoms occasionally, as well as their own version of the rhythm method. By their late 20s, they have had at least as many children as they want, earlier and more quickly than they wanted to have them. Given a real chance, they would stop.
Oh, wait a minute. I knew it.
You did it, Pumpkin. I was the kind of face you would.
I got one of Richie's hands.
Why don't you stick it in the center there?
All right, Roy.
How is Mary?
But without the availability of effective contraception, they are likely to have 3 more pregnancies, probably 1 illegal abortion, and 2 more living children. This may make it impossible for them ever to escape from poverty. It will severely limit the lives of the children already born. Who are the women who need birth control help? According to a Planned Parenthood study based on a special tabulation made by the United States Bureau of the Census, 83% are or have been married. 59% are now living with their husbands. 74% have had some high school education. Although they say they want 3 children, 52% of those between 30 and 34 years of age already have 4 children or more. 70% are white, 30% are non-white. 15% are on welfare. 85% are part of self-supporting family units. 70% have less than 70 cents per person for food each day. These are the women who need birth control help and do not yet have it. Mainly in our cities, but also in our small towns and rural areas, especially in the South. For a more detailed picture of the people who need subsidized birth control services and a discussion of what this means for program development in individual communities, send for the booklet 5 Million Women, published by Planned Parenthood, World Population, 515 Madison Avenue, New York, New York.